What if diabetes has been quietly warning you for months, maybe even years, and the clues weren't hiding in a laboratory report at all? What if they were right in front of you every single day, in your hands, and in your eyes? Most people believe diabetes only begins the day a doctor calls with abnormal blood test results. But after nearly 2 decades of caring for older adults, I can tell you something I've seen hundreds of times. By the time blood sugar becomes high enough to trigger a diagnosis, the body has often been sending subtle warning signs for months, or even years. The problem is, most people don't recognize them. They blame aging, they blame stress, they blame dry weather, or they simply learn to live with the symptoms. And that's exactly why diabetes is often called the silent disease. Not because it doesn't give warnings, but because those warnings are so easy to dismiss. Today, I'm going to show you 7 of the most overlooked signs that may appear in your hands and your eyes long before many people realize they have diabetes. Some of these signs seem completely harmless. One of them is something I see almost every week in my clinic. And the final sign is so subtle that many people notice it every day without ever realizing what it's trying to tell them. If we've never met before, one lesson has become incredibly clear. The body almost always whispers before it screams. It rarely surprises us overnight. Instead, it leaves little clues, tiny changes, small discomforts, subtle differences that seem unrelated. The trouble is, most people don't know how to connect those dots. Just last week, I met a wonderful woman during what was supposed to be nothing more than her yearly physical. She had recently turned 62. She stayed active, walked every morning, watched what she ate, and she told me she felt perfectly healthy. As we talked, I asked a question that caught her completely off guard. Have you noticed anything different about your hands lately? She smiled and laughed. Actually, yes. My fingers feel a little stiff when I wake up. My skin has gotten much drier. And lately I've been needing brighter light just to read recipes. She shrugged. I figured that's just what getting older feels like. When we finished her examination, I recommended routine blood work. A day later, her fasting blood glucose came back at 198 milligrams per deciliter. She had type 2 diabetes. Based on her laboratory results and the symptoms she'd been experiencing, there was a good chance her blood sugar had been elevated for several years. The signs had been there. She simply didn't know they mattered. Stories like hers are far more common than most people realize. According to the Centers for Disease Control and Prevention, millions of Americans are living with diabetes without knowing they have it. Many discover it only after complications begin affecting their nerves, their eyesight, their kidneys, or their circulation. The encouraging news is this: a simple blood test can often identify diabetes early. But first, you have to recognize that your body may already be asking for help. So let's begin with the very first sign, and it's one that nearly every patient has experienced at least once. Sign number 1, frequent tingling or numbness in your fingers. The first sign is something almost everyone has experienced at some point. And because it's so common, it's also one of the easiest to ignore. Patients often smile and tell me, "Doctor, my hand just falls asleep sometimes. I probably slept on it the wrong way. Maybe I was holding my phone too long." And they're right. Every once in a while, that happens to everyone. But here's the question I always ask next. Is it happening more often than it used to? Does it happen even when there's no obvious reason? Because if the answer is yes, that's when I start paying attention. One of the earliest complications of elevated blood sugar is something called peripheral neuropathy. Simply put, high blood sugar slowly damages the tiny nerves that carry messages between your brain and your hands. This damage doesn't happen overnight. It's gradual, quiet, and often completely painless in the beginning. That's exactly why so many people overlook it. I explain it to my patients using an example almost everyone understands. Imagine the electrical wiring inside an older home. When the protective insulation around those wires begins to wear away, electricity still flows, but not smoothly. Lights flicker, switches stop responding perfectly. Sometimes they work, sometimes they don't. Your nerves behave in much the same way. Healthy nerves carry clear, accurate signals. Damaged nerves send confusing messages. That confusion is what creates tingling, pins and needles, or brief episodes of numbness. According to the American Diabetes Association, diabetic peripheral neuropathy affects nearly half of people living with diabetes, and in many cases, these abnormal sensations begin long before a person receives a diagnosis. That's why I never tell patients to ignore recurring numbness. I'm not saying every tingling finger means diabetes. Far from it. Carpal tunnel syndrome, vitamin deficiencies, neck problems, and several other conditions can cause similar symptoms. But if numbness keeps returning without a clear explanation, especially alongside other warning signs we're discussing today, it's worth mentioning to your healthcare provider. Your body could be trying to tell you something important. Daily habit. One of the simplest things you can do is take a 20 to 30-minute walk every day. Regular movement improves circulation throughout your body, including the tiny blood vessels that nourish your nerves. At the same time, begin reducing foods with added sugar whenever possible. Not all at once, not perfectly. Just start making small improvements today. Those small decisions often become powerful habits over time. Now, the next sign surprises almost everyone I see, because most people never imagine it could have anything to do with blood sugar. In fact, they usually blame the weather, or aging, or simply getting older. Have you ever looked at the back of your hands and thought, they just don't look like they used to? Maybe the skin feels tighter, less flexible, more dry than usual. Perhaps lotion helps, but only for a short time. Many of my patients tell me, "Doctor, I buy better hand cream every winter." Nothing seems to last. Dry skin is certainly common as we age, but persistent dryness that's accompanied by stiffness or a shiny appearance can sometimes point to something happening beneath the surface. When blood sugar remains elevated over long periods, it affects the tiny blood vessels that supply oxygen and nutrients to the skin. At the same time, it can alter collagen, the protein that gives your skin flexibility. As circulation slows, your skin may lose some of its natural moisture and elasticity. I like to compare it to a brand new leather glove. When it's well cared for, it stays soft and flexible. But if it slowly dries out year after year without proper conditioning, it becomes stiff, less comfortable, and eventually, tiny cracks begin to appear. Your skin can behave in a very similar way. Another condition doctors sometimes see is called diabetic neuropathy, sometimes referred to as diabetic stiff hand syndrome. People often notice their fingers feel tight first thing in the morning. Making a fist becomes slightly harder. Buttoning a shirt may take a little longer. These changes often develop so gradually that people simply assume they're part of normal aging. Research published in diabetes journals has shown that changes in skin texture and hand mobility are more common among people with long-standing elevated blood sugar than many realize. Again, this doesn't automatically mean diabetes. Arthritis, eczema, thyroid disorders, and simple aging can all affect the skin. But when several of these signs begin appearing together, it's time to pay attention. Daily habit. Every evening before bed, apply a fragrance-free moisturizer to your hands. Spend 2 or 3 minutes gently massaging each finger and palm. Not only does this help keep the skin healthy, but the massage also encourages circulation, and make sure you're eating enough protein throughout the day. Foods like eggs, beans, Greek yogurt, fish, or lean chicken provide the building blocks your body needs to maintain healthy skin and connective tissue. The next warning sign doesn't appear in your hands at all. It appears in your eyes. And it's one of the most commonly dismissed symptoms I hear in my office. Patients almost always tell me the same thing. "Doctor, I think I just need stronger glasses." Sometimes they're right, but sometimes it's something much more important. Sign number 3, blurry vision that comes and goes. Now, we come to one of the most overlooked warning signs of diabetes, and it's the one that sends many people to the eye doctor before they ever think about checking their blood sugar. Almost every patient says something like this. "Doctor, I think I just need stronger glasses. My reading glasses don't seem to work like they used to. Some days I can see perfectly. Other days everything looks slightly blurry." Sometimes that's exactly what it is. As we age, our eyesight naturally changes. But when your vision seems to go in and out of focus, especially later in the day, after meals, or from one day to the next, your eyes may be responding to changes in your blood sugar. Here's what's happening inside your body. When glucose levels become too high, extra fluid begins moving into the lens of your eye. That tiny change causes the lens to swell ever so slightly. When the shape of the lens changes, even by a small amount, your ability to focus changes too. The result? Words become fuzzy. Street signs seem harder to read. Television subtitles look blurred, and you find yourself constantly cleaning your glasses, even though the glasses aren't actually the problem. I explain it to patients like this. Imagine looking through a camera lens. Now imagine someone sprays a very thin layer of water across the glass. The camera still works. The picture is still there. But nothing looks perfectly sharp anymore. That's very similar to what fluctuating blood sugar can do to your vision. According to the American Diabetes Association, changing vision is often one of the earliest symptoms people notice before receiving a diagnosis of type 2 diabetes. And the important thing is this: the blurriness often comes and goes. That's exactly why so many people ignore it. They wake up the next morning, their vision feels normal again, and they assume the problem has disappeared. But the underlying issue may still be there. Now, blurry vision doesn't automatically mean diabetes. Dry eyes, cataracts, glaucoma, or needing a new prescription can all cause similar symptoms. But if your vision seems to fluctuate along with several other signs we're discussing today, it's worth bringing up during your next medical visit. Daily habit, 1 habit I encourage nearly every patient to adopt is taking a 10 to 15-minute walk after meals. Light activity helps your muscles use glucose more efficiently, which can reduce sudden spikes in blood sugar. It also benefits your heart, your circulation, and your overall energy levels. Another simple habit: keep track of when blurry vision occurs. Does it happen after breakfast? After dinner? Only in the evening? Patterns like these can provide valuable clues for both you and your doctor. Now, the next warning sign surprises almost everyone, because most people never associate it with diabetes. They assume it's simply part of getting older, or that they forgot to drink enough water. But sometimes, your hands are trying to tell a much bigger story. Sign number 4, burning or hot sensations in your palms. Have you ever been sitting quietly in the evening, watching television, reading a book, or lying in bed, when suddenly your palms begin to feel unusually warm, almost like they're burning from the inside? Many patients tell me, "Doctor, my hands feel hot at night." Sometimes I even stick them outside the blanket because they feel like they're on fire. Others describe it differently. They say it feels like tiny electric shocks, or thousands of little pins poking their palms. During the day, they barely notice it. But once everything becomes quiet, the sensation suddenly becomes impossible to ignore. This happens because damaged nerves don't always become numb. Sometimes, they become overly active. Instead of sending normal signals to the brain, they begin sending false alarms. Your brain interprets those faulty messages as burning, heat, or pain, even though nothing is actually wrong on the surface of your skin. Think about your home's smoke detector. If the sensor becomes damaged, it may suddenly start beeping in the middle of the night. There's no smoke, no fire, nothing dangerous in the room. The sensor itself is malfunctioning. Your nerves can behave in much the same way. The burning sensation isn't coming from your skin. It's coming from irritated nerve fibers that are no longer sending accurate information. Research published in Diabetes Care has shown that burning sensations in the hands and feet are among the earliest symptoms reported by many people later diagnosed with diabetic neuropathy. Unfortunately, many spend months treating the symptom instead of investigating the cause. They buy new lotions, wear lighter gloves, turn down the thermostat, or assume it's simply another part of aging. Meanwhile, the nerves continue becoming more irritated. Again, this symptom isn't exclusive to diabetes. Vitamin B12 deficiency, certain medications, carpal tunnel syndrome, and other nerve disorders can also produce similar sensations. But recurring burning, especially when combined with tingling, blurry vision, or slow-healing cuts, should never be ignored. Daily habit. Start with something remarkably simple. Aim for 8 glasses of water throughout the day, unless your healthcare provider has given you different instructions. Proper hydration supports healthy circulation and helps your kidneys regulate excess glucose more effectively. Next, increase the amount of fiber in your meals. Foods such as oatmeal, beans, lentils, berries, vegetables, and whole grains help slow the absorption of sugar into your bloodstream. That means fewer dramatic blood sugar spikes, which is exactly what your nerves need. The next sign looks so small, most people don't even think it's worth mentioning. A tiny paper cut, a cracked fingertip, a scrape from gardening. But for some people, those tiny injuries tell a much bigger story than they realize. Sign number 5. Small cuts on your fingers that take too long to heal. This next sign is one that genuinely concerns me, because by the time it appears, your body may already be struggling to repair itself the way it should. Many of my patients tell me the same story. "Doctor, it was just a tiny paper cut. I nicked my finger while cooking. It wasn't serious, so I didn't think much about it." At first, they simply cover it with a bandage. A few days pass. The cut is still there. A week later, it's healing much more slowly than expected. Most healthy cuts begin closing within a few days, but persistently elevated blood sugar changes that process. Your blood vessels become narrower, circulation slows, oxygen, nutrients, and the white blood cells responsible for fighting infection take longer to reach the injured area. The result is a wound that simply refuses to heal as quickly as it once did. I often explain it using a simple example. Imagine firefighters trying to reach a small house fire. Normally, the roads are clear and they arrive quickly. But now imagine every road leading to that house is under construction. Traffic slows to a crawl. The firefighters eventually arrive. But precious time has already been lost. That's very similar to what happens when circulation is affected by high blood sugar. Your body's repair team is still trying to help. It just can't get there efficiently. According to the Centers for Disease Control and Prevention, poor wound healing is one of the most common complications associated with long-term uncontrolled diabetes. Many serious infections begin as nothing more than a small cut that never fully healed. That doesn't mean every slow-healing wound is caused by diabetes. Age, certain medications, poor circulation, or immune system conditions can also delay healing. But if you notice that even small cuts on your fingers linger much longer than they used to, it's worth paying attention, especially if you've already noticed tingling, burning, or changes in your vision. Daily habit. After washing your hands each evening, take just 30 seconds to actually look at them. Check around your fingertips, your knuckles, and your nails. If you notice a cut, clean it gently with soap and water. Apply an antiseptic if appropriate, cover it with a clean bandage, and monitor it closely. If it hasn't noticeably improved within 48 hours, contact your healthcare provider. Don't simply hope it will get better on its own. The next sign doesn't appear on your skin. It doesn't cause pain. In fact, most people simply assume they haven't had enough water, but sometimes your body is trying to replace something it's losing much faster than normal. Have you ever finished an entire glass of water only to feel thirsty again a few minutes later? Many of my patients tell me, "Doctor, my mouth always feels dry. I keep a bottle of water beside my bed every night. I'm drinking more than ever, but I still feel thirsty." Naturally, most people assume they're simply becoming dehydrated. Maybe it's the weather, maybe the heating system in the house, maybe they forgot to drink enough throughout the day. Sometimes that's exactly what's happening. But persistent thirst can also be one of the body's earliest responses to elevated blood sugar. Here's why. When glucose levels become too high, your kidneys work harder to remove the excess sugar from your bloodstream. The problem is, glucose doesn't leave by itself. It pulls water along with it. As more water leaves your body through urine, your brain receives a signal that you're becoming dehydrated, so it tells you to drink, again and again. I like to compare it to a sponge. Imagine pouring syrup onto a sponge and then trying to rinse it clean. You'll need much more water than usual before everything washes away. Your kidneys face a similar challenge when blood sugar stays elevated. They're constantly trying to flush out the extra glucose, using your body's water supply to do it. According to the National Institute of Diabetes and Digestive and Kidney Diseases, excessive thirst and frequent urination are among the classic early symptoms of diabetes, yet many people dismiss them because they develop gradually over time. One extra trip to the bathroom, one extra bottle of water, then another. Eventually, it simply becomes part of everyday life. Daily habit. For the next several days, pay attention to how much water you're actually drinking. You don't need to obsess over every ounce. Just notice the pattern. Also pay attention to what you're drinking. Replacing sugary soft drinks, sweetened tea, or fruit juices with plain water or unsweetened beverages can make a meaningful difference. If you're constantly thirsty despite staying well hydrated, especially if you're waking several times during the night to urinate, it's time to discuss those symptoms with your doctor. We've now covered 6 warning signs, but the final one is probably the most commonly ignored of them all. Almost everyone blames it on getting older, on having a busy day, or eating too much lunch, but sometimes it's your body's way of telling you that the fuel is there, yet your cells simply can't use it. Sign number 7, feeling extremely tired. Shortly after eating, we've reached the final sign, and in many ways, it's the one I hear about more than any other, not because it's the most dangerous, but because almost everyone assumes it's completely normal. Patients often tell me, "Doctor, lunch just wears me out. After dinner, I have to sit down. If I eat a big meal, I can barely keep my eyes open." Most people blame age, a busy day, poor sleep, or simply eating too much. And yes, sometimes that's exactly what's happening. But when that overwhelming wave of fatigue happens almost every time you eat, especially meals high in bread, rice, pasta, desserts, or sugary drinks, your body may be struggling to manage glucose effectively. Here's what's happening inside. Every time you eat, your digestive system breaks food down into glucose. That glucose enters your bloodstream and is supposed to move into your body's cells, where it's used as energy. The hormone responsible for helping glucose enter those cells is called insulin. But when the body becomes resistant to insulin, glucose stays trapped in the bloodstream instead of reaching the cells that need it. The result is surprisingly frustrating. There's plenty of fuel available, yet your muscles and organs can't use it efficiently. So instead of feeling energized after a meal, you feel exhausted. I explain it to patients this way. Imagine filling your car's gas tank completely. The tank is full. There's more than enough fuel. But the fuel line is blocked. No matter how much gasoline is sitting in the tank, the engine can't use it. Eventually, the car slows down. Your body experiences something very similar. The glucose is there, the energy is there, but your cells can't access it properly. According to the American Diabetes Association, persistent fatigue is one of the most frequently reported symptoms among people with prediabetes and type 2 diabetes. Unfortunately, it's also one of the easiest symptoms to dismiss. People simply accept it as part of getting older. Years pass. Meanwhile, blood sugar continues damaging nerves, blood vessels, eyes, and kidneys without being noticed. Daily habit. One of the most effective habits is also one of the simplest. After meals, take a gentle 10 to 15-minute walk. You don't need to exercise intensely. Just moving your muscles encourages them to use glucose more efficiently. Many of my patients tell me this one small habit noticeably improves their afternoon energy. You may also benefit from building meals around lean protein, vegetables, healthy fats, and high-fiber carbohydrates instead of relying heavily on refined sugars and processed foods. Small changes made consistently often produce the biggest long-term results. Today, We've talked about 7 warning signs that many people dismiss as ordinary aging. Let's quickly review them. Frequent tingling or numbness in your fingers, tight, dry, or unusually shiny skin on your hands, blurry vision that comes and goes, burning sensations in your palms, especially at night, small cuts on your fingers that heal slowly, constant dry mouth and unusual thirst, feeling unusually tired after meals. Now, I want to be very clear about something. Having one of these symptoms does not automatically mean you have diabetes. Many other medical conditions can cause similar problems. That's why this video isn't meant to diagnose anyone. Instead, it's meant to help you recognize patterns, because that's what experienced physicians look for. One symptom may not mean much, but when several appear together, especially over weeks or months, it's worth having a conversation with your healthcare provider. One of the hardest conversations I have in my office isn't telling someone they have diabetes. It's telling someone they could have known years earlier. I've sat across from patients who had tingling in their fingers, changing vision, constant thirst, and slow healing cuts for years. Not because they ignored their health, but because no one had ever explained that these seemingly unrelated symptoms could all point toward the same condition. The good news is, type 2 diabetes is often highly manageable when it's identified early. Healthy eating, regular movement, weight management, monitoring blood sugar, and working closely with your healthcare provider can dramatically reduce the risk of serious complications. That's why awareness matters, not fear. Awareness. Tonight, before you go to bed, I want you to do something that takes less than a minute. Look carefully at your hands. Notice your fingertips. Look at your nails. Pay attention to your vision. Think about how you've been feeling after meals. Have you noticed any of the signs we discussed today? If the answer is yes, don't panic. But don't ignore them either. Schedule a visit with your healthcare provider. A simple blood glucose test, often inexpensive and covered by insurance or Medicare, can provide answers, and if needed, help you start treatment before more serious complications develop. That one appointment could protect your eyesight, your nerves, your heart, your kidneys, and your independence for years to come. If you found today's video helpful, please take a moment to click the like button. It helps YouTube share this information with more people who may need it, and I'd love to hear from you. Have you experienced any of these warning signs? Or has someone in your family? Leave a comment below. I read as many of your comments as I can, and they often inspire future videos. If you're new here, consider subscribing and turning on notifications. Every week, I share practical, easy-to-understand health information designed specifically for adults over 60, helping you stay informed, stay independent, and live a healthier life. Thank you for spending these minutes with me. I'm Dr. Walora. Take care of yourself. Take care of those warning signs, and I'll see you again in the next video.